And Dr. Erica joins us here in studio from St. Vincent Healthcare. And as I mentioned, January is Cervical Cancer Awareness Month, and that's what we're talking about. So let's start off by mentioning how common is cervical cancer?
So cervical cancer these days is much less than it was 50, 100 years ago, where it was one of the top cancers in women. Now, 12,000 women still get diagnosed every year with cervical cancer in the United States, with 4,000 women dying every year, which is really hard because we have come leaps and bounds in the last few decades in terms of diagnosing and treating cervical cancer, to the point that if you get good screening, if women get good screening and practice, smart lifestyle choices, they will not get, they will not die. They shouldn't die of cervical cancer anymore. So that's kind of the bottom line today is, preventing and treating cervical cancer early. It was even described way back in 400 BC by Hippocrates, cervical cancer. And he said it was incurable, but he was wrong because now we can cure it.
Yeah, we proved him wrong. And I was curious, how does cervical cancer relate to HPV? What's the connection there?
Yeah, so in, I think, 1976, they identified HPV virus, which is the human papillomavirus, in the cervical cancer cells, and they saw that cervical cancer was only happening in women who'd been sexually active. So they were able to put all of that together and find out that it is, HPV is a sexually transmitted disease, but with that being said, 93 million Americans right now have HPV. So it is very common. I don't think people realize that so much. Some people clear it on their own. Some people it causes a more long-lasting infection, and when that happens, it can cause some changes to those cervical cells that can lead to cancer. So HPV is the causative agent of cervical cancer. So the bottom line is preventing HPV, and we now have a vaccine that was approved in 2006 for boys and girls ages starting about age 11 up until 26, and that doesn't prevent all of them, so you're not in the clear once you get that, but it definitely can help with some of the high-risk HPV strains. And then limiting your sexual partners when you are sexually active, using protection to help decrease the risk of that, and then seeing your provider regularly and getting pap smears. Now, for most women, it starts at 21. For all women, it's supposed to start at 21. We used to do it earlier, but now it's 21. And if you have a normal pap smear at that time, you can go every 3 years until you're 30. And then you can decide if you want to test for HPV at the same time as the pap smear. If both of those are negative or normal, you can even spread it out to every 5 years up until 65. And women who've always had normal pap smears up to 65 can consider being done with testing at that point. So, if it's abnormal, they will test for the HPV, and there's things we can do early on if we catch it early. And so it's nothing to be ashamed about. It's nothing to, be afraid of. It's, it's relatively easy, and the problem is when you don't go and get tested. That's why we're still seeing cervical cancer cases in this country. So go get tested.
Yes, go get tested. Thank you so much, Dr. Erica.
Yeah.
We'll be right back after this break.